Hi, my name is Dr. David Gifford. I'm a geriatrician and Chief Medical Officer at the American Healthcare Association and the National Center for Assisted Living, where we represent nursing homes and assisted living. And we're here today with Dr. Ling from the Center for Medicare and Medicaid Services. Dr. Ling?
Hello, I am Dr. Shari Ling. I'm serving as the Deputy Chief Medical Officer with the Centers for Medicare and Medicaid Services, which is the federal agency that oversees nursing homes. I'm a geriatrician, as is Dr. Gifford, and also a volunteer dementia care provider with the VA.
So Shari, we wanted to talk today about the way staff members in nursing homes and other long-term care facilities like assisted living can protect their residents during this upcoming holiday season. As we see COVID cases rise across the country, it's really never been more important for caregivers to keep themselves and their residents safe, as they all know, and we hear about it all the time. But I've been hearing a number of myths out there, and I thought maybe we could talk about some of the myths and the facts out there that will help people get through this holiday season. You ready?
I am.
So myth one I've been hearing about is, I hear people say, I was exposed to someone who had COVID, I got a test right away and it came back negative, so I'm not infectious.
Yes, Giff, I have heard that as well. And the fact is that you can still have COVID even though you receive a negative test result. This is because the incubation period for the virus is anywhere from 2 to 14 days, which means you could have the virus and test negative on day 2, but then test positive on days 3, 4, 5, or 6, and so on, all the way through day 14. So for people without symptoms, a negative test does not mean that you are in the clear. So one action that we might suggest is that if you've been exposed to someone with COVID, you need to isolate for 14 days. And unless you have symptoms, you should wait to be tested no sooner than 5 to 7 days following the exposure.
Because I hear a lot of people for the holidays are going to get tested right before they go home, because then they're safe to go out there. So I think it's a very good tip.
Yes, well, thank you for bringing this up. And just to share myths, I've also heard that once I leave my nursing home or assisted living where I work, that I don't need to worry about who I'm around or even wear a mask. What are your thoughts there, and what are the facts, Giff?
That's a really good point. I've actually heard that from some of my own family members out there. The number one reason COVID is getting into nursing home and assisted living communities is because people are getting infected when they're out in the community. Family gatherings and eating in restaurants appear to be some of the major reasons people are getting infected around the country. So more than half the people who catch the virus never show symptoms, or they're sometimes called asymptomatic. So staff who are unknowingly infected because they were around family members who are unknowingly infected could bring the virus into the center. So one thing people can think about is, we know it's hard with the holidays coming up to not see family and get together, but it's really important to be careful about large gatherings with extended family members. So it's really important to continue to wear masks when you're out in the public area, masks when you're getting together with family members, and keep that physical distance of at least 6 feet apart. The more you can do outdoors, the better. It's hard, I know, with the weather coming up. Regularly washing your hands are really some key steps that we know work to help prevent the spread. And it's more important during this holiday season than ever to do that.
Mm-hmm.
So another myth I've been hearing, Shari, is I only need to wear a source control mask or a mask when I'm around my residents in the nursing home or assisted living, but I don't need to at other times. What do you think about that?
So thanks for mentioning that myth, Giff. I think it's important for us to remember that your mask not only protects you, but protects your residents and your coworkers and anyone else that you are around. Remember that people can have the virus and not know it, because more than half of people who are infected never have symptoms. So when you're interacting with other staff or out in the community, a mask decreases any spread of the virus that you may unknowingly have to others. So I think the bottom line here is always wear a source control mask in all areas of the nursing home or assisted living community, even in the break room or in the conference room, the laundry, kitchen, common areas, especially when you're interacting with your coworkers in the facility, as well as when you are out in public. So the final myth that I have heard, Giff, is, and this one, you know, is a little bit challenging. People are worried about, you know, offending their colleagues, but I've heard that, you know, when I see other staff members not wearing PPE properly, that it's actually not my job to say anything. What are the facts here?
Well, you know, I think the only way we're going to get through this virus is if we all pull together and remind each other what to do. I mean, it's easy to forget. It's easy for the mask or your PPE to fall off or not be quite where it needs to be. So adjusting to this is really a new normal of wearing masks over the nose and mouth. I mean, I've seen people with the mask over just the nose or over the mouth. And frankly, I've been wearing it sometimes and it falls off that way. My wife reminds me, and then she has the same issue and I remind her. My son reminds me of that. I think our responsibility is to remind each other of that. It shouldn't be an embarrassment of that. But making sure your coworker is following the best practices is really going to protect not only just the residents, but you and everyone else there. And the only way we're going to get through this is if we work together. So, you know, find a thoughtful way to remind a colleague if you notice their mask is not being worn properly. And frankly, if someone reminds you, you should thank them for that. Encourage them to remind you as well. That way it doesn't feel like there's doing something wrong. Make it a collective effort, because without that, the virus is going to win. And we need to band together to beat this virus as we go forward. Well, thanks, Dr. Ling, for taking the time to go through this with the myths and facts out there. I know that many of staff, and we hear from staff all the time, they're very concerned about the spread of this virus to their residents and to them and their family. And hopefully today's discussion gives some idea of how to sort of be safe around the holidays and still visit and still care for the residents that are out there. But thank you very much for taking the time today, Dr. Ling.
And thank you, Giff, for our conversation today. And thank you to all of you who are tuning in today for your dedication and care to our beneficiaries day to day.